Welcome to Logical Ayurveda. Nowadays, when you go near a pediatric hospital during rainy season or during a cold season, you can see flocks of babies, masses of babies along with their parents coming to the pediatric allopathic doctor and seeing for the same disease again and again, for same fever, same cough that is there since a week, since 15 days, since a month, and they are getting treated for the same. They are being kept nebulizer for the same. They are being admitted for the same. So it is very painful to see those patients waiting in long queues and not getting cured. But when those pediatric babies come to an Ayurvedic doctor and take the medicines patiently, very rarely these babies come back again and again with the same disease, and at a period of time they develop immunity, and very rarely and during a striking climatic change only they come to the doctor, and they don't come so often because good Ayurvedic doctor always teaches them what basic medicines to be given in fever and certain conditions, what difference in patya apatya should be done, so that they make sure that the particular baby has a immunity and does not develop fever again and again. So it makes me stress one thing more. Ayurveda is the best solution for solving repeated pediatric ailments and give immunity to the pediatric patients all over the world. As a responsible doctor to the society, as a responsible Ayurveda doctor to the society, we have the job of keeping the children free from erratic and irresponsible use of antibiotics and steroids. I am not telling every doctor does that. There are people who do that. There are people who use steroids recklessly. There are people who use antibiotics recklessly, even for small pediatric ailments. And eventually those children develop resistance to the particular antibiotics and other medicines. What I am telling is, as a responsible doctor of the society, we have the job of keeping the children free from this erratic and irresponsible use of antibiotics and steroids, and give them immunity so that those antibiotics and those steroids can be best used when there is a real emergency condition, when there is a horrible emergency condition, when there is a striking emergency condition like pneumonia, COVID, etc. That time that antibiotics and steroids should give results, not in normal fever, normal cough, normal rhinitis. Okay, those antibiotics and steroids can be best put to use in emergency condition. For that, in emergency condition, such particular medicine should not give resistance, should give results. When they will not give resistance, when they will give results, when they are not used so much often. Okay, when you use an antibiotic for 10th time, 11th time, same antibiotic will not give result. But when you use Amrita Arishtam for 50th time, but when you use Amrita Arishtam for 500th time, even 501 time, during the 501 time also, it will give the same result to the patient, but it is not the same case with the antibiotics. But I'm not blaming antibiotics should not be used. They should be best used. They are needed in the condition of real emergency. In the condition when the patient should get immediate cure. In the condition when the patient has mass infection. It should be spared for that time, not for normal time. Maran Kulika. This is about my one of the very favorite medicine in my clinical practice, Vettumaran Gulika. Today, you go to any pediatric doctor they will tell you that repeated fever, patient has repeated fever, increase in body temperature will lead to neuronal excitability. Neuronal excitability will lead to convulsions. So, for the repeated fever and patients who have convulsions, they give rigorous temperature control, and they give benzodiazepines like clobazepam, like frisium tablet 5 mg, etc., in order that the baby will not get convulsions. But what if I tell you that they have discovered this thing only within this 30 years of medical practice, and it was discovered centuries back by acharyas. Centuries back by acharyas. Vettu Maran Goliga is derived from a Kerala Siddha tradition. The name Vettu means convulsions. Maran means to stop, to change, to stop convulsions. Okay. Vettu Maran Goliga is not given for convulsions, is given for fever. Is given for fever in order to protect the convulsions. It's given in a mind that complication should not come. It is given for fever in the aim of protecting the convulsions. Vettu Maran Golika. It is there in Kerala Siddha tradition. Since so many years this is practiced. See the beauty of the medicine. So Acharyas knew that the increase in the fever will cause neuronic disturbances, thereby leading to convulsions. This was known, something which is known centuries ago, and this mere truth that they knew it was so much fascinating. If you go to any pediatric allopathic hospital and you ask the doctor for repeated convulsions and fever patients, they always used to prescribe phenobarbitons like frisium along with the fever controlling drugs and antibiotics. So isn't it fascinating to know that our acharyas knew this truth centuries back, and they have named a tablet for, in the hindsight, that the particular patient should not have the complication of the underlying condition. The tablet is not named for the underlying condition, but it is named to prevent the complication of the underlying condition. Such fascinating is the Vettu Maran. This is why we love Ayurveda. So what is the content of Vettu Maran Gulika? Vettu Maran Gulika is actually Rasoshadi. It contains Shuddha Hingula, Tankanam, Trikadukam, Ajamodam as a major content. So what is the Vettu Maran Gulika's concept based on? It is based on the general concept of Ayurveda that Sarva Vyadi Amodbhavam. Everything generates from Ama. If you correct Ama, if you correct Agni, if you do Deepana Pachana to the patients, most of the disease go away. So as with any proper Ayurvedic Rasoshadis, Vettu Maran also works with different Anupanas in different conditions. So according to the Acharyas, it is given along with the Jiraka in Vishama Jora and abdominal colic, etc., and along with the Ardharka Swarasa in controlling fever, and along with the Narikela Jala, coconut water, in UTI. But these Anupanas I rarely use. The most Anupanas, instead of Jiraka I choose Jiraka Rishta, instead of Narikela Jala I choose Punarnavasam. So Anupanas do not have to be a food or a supplement. Anupanas can also be the medicine that you co-prescribe along with the particular Rasoshadis. So in this case, Anupanas can be Amrita, Vettu Maran, Amrita Arishtam can be Vettu Maran, Vettu Maran and Punarnavasam also can be Anupana. So based on the Vyadis, you can change the underlying Anupana. Because this Vettu Maran the Guliga was taught to me, this proper action of this Guliga was taught to me by Dr. Geeta, who used to use it big time. And she used to tell, whenever I have a fever, I take 2 guligas of Vettu Maran, and by evening my bowel will be cleared and I'll have hunger and I'll sweat it out and my fever will be alright. So at that particular point of time when we had that discussion, I started using Vettu Maran Gulika, and very importantly, if you're using Vettu Maran Gulika, please do not use any other company than number 1 AVP, number 2 Vaidyaratnam. Only use these 2 companies for getting better result. I don't trust any other companies for giving this kind of result. So Anupanas, you can use anything based on the particular disease condition. My combination in clinic, which I combine and keep in a single bottle, all 3 aristas mixed together, that is number 1 Amrita Arishtam plus 2 Vasa Arishtam plus 3 Bala Arishtam. I call these 3 aristas 3 commandos of fever destruction. Why? Because it is such a beautiful medicine. It has cured millions of patients. And this was taught to me by my guru, So I always have lot of love and respect for these three medicines. So what are the actions of these three medicines? Amrita Arishtam. Amrita is Tikta Pachana. Amrita Arishtam is Pittahara. It reduces the Ajirna and fever. It reduces the temperature. It contains major content is Amrita and Dashamula, as you everyone know. Vasa Arishtam contains Vasa as a main content, and it is given in, it reduces high fever, reduces Pitta, and causes expectoration of the phlegm. Bala Arishtam, it relieves tiredness. Bala is Madhura Snigdha, and it is given in Arishta form. So, in fever, for reducing temperature, I give Amrita Arishtam. If that is associated with the kapha, that is phlegm is there, I mix Vasa. And if the patient is feeling a lot of tiredness, you should mix Bala. So ideally, I mix Amrita Vasa Bala. For most of the patients, I name the medicine as AVB, and I keep it in the rack, and I charge it at the premium because of the Yukti, and we give it to the patient. It gives beautiful results. Remember this, Amrita plus Vasa plus Bala is a very beautiful combination in pediatric patients. Amrita to reduce temperature, Vasa to cause to relieve the skannatvan of the kapha, and Bala to give strength to the child. So this is the most famous combination that I use in pediatric medicine. And even in COVID times, we used to give this Amrita Vasa Bala, and the dosage of Amrita Vasa Bala is all three mixed together, 5 ml for very small children, starting from 6 months to 1.5 years. You can use only 5 ml. Above that, we can use 10 ml. And if the children is more than 20 kg, if the children weighs more than 20 kg, any Arishtam singularly or all three mixed together, you can use more than 15 ml. If the child is more than 20 kgs, you can use 3 teaspoons, that is 15 ml of Arishta. If the child is only 6 months to 1.5 year old, you can use 2.5 to 5 ml of Arishta, depending on the weight of the weight of the patient. Or if the child is more than 20 kgs, you can use 15 ml. So this is the dosage of any Arishta. So Amrita Vasa Bala, I use it for almost every patient now and then, depending on the condition. So wherever there is exceptionally I do not prefer Amrita Vasa Karishta in rare conditions where there is a severe lower respiratory tract infection associated with fever. When there is a severe wheezing, kapha obstruction, etc. In such cases, I use Pipalyasavam. And even in COVID time, for fever prevention, we used to give Amrita Vasa Bala, all these Arishtams, daily to pediatric patients, and it has given very good results. Even to the adult patients, 30 ml dosage for adults. For just COVID protection, for fever protection, we used to give this 1 time a day for just protection, for prevention not to get COVID. And it worked out very good. Actually, this was taught to me by Muralidhar Sharma sir, that particular Amrita Arishtam can be given for fever prevention also. And it's given beautiful results.